Welcome to the Practitioner Pod edition of our Learn with Lo series. I love getting an opportunity to kind of step outside of the patient care and really talk to my fellow practitioners out there. Obviously, if you are also a patient, you get a lot from these practitioner conversations because you can start to kind of put yourself into the seat of various providers or practitioners that you've worked with, and also maybe understand a little bit more of the nuances and tools that you want to make sure your provider understands, the training that they've had, and kind of making sure that you're aligning with providers that have the similar mindset as you as well too. So without further ado today, welcome to all of my fellow providers and practitioners. And if you have clicked on today's episode, you are probably just as curious as I know I once was about getting all your hands that you can on the latest and greatest and the most innovative thought patterns that happen in our world of functional medicine. And that is exactly what I want this platform to be, because as I learn and grow as a provider, I want to mingle and learn and teach other practitioners all of the great frameworks and philosophies that I'm finding effective in my practice, just as much as I'm learning from other providers as well too. And so with our series that we've been talking about lately, we've been talking about this series that I've dubbed entitled "The Gut Terms That Everybody is Using Yet Few People Understand" series. And so if you've been following along with this series, more from a patient-facing perspective, we've been talking about some of these very common terms that you hear on social media: leaky gut, SIBO, IBS, candida, and really starting to educate a little bit more about what these overgrowths are telling us, what these patterns in the gut are telling us, and more so what some of the maybe more short-sighted or ineffective treatment patterns are that are leaving people really stuck spinning their wheels in terms of time and overall monetary investment as well too. So I know with us as providers, a lot of us very, very well-meaning, very well-intentioned and caring providers want to be able to do the best by our patients. We want to be able to provide the very best care, and we want to be able to help as many individuals as we possibly can with the most comprehensive approach, right? And so a lot of times that takes us really being able to kind of expand our own clinical toolbox, because as the growing landscape of immune dysregulation, autoimmune patterns, as well as hormone dysregulation really take shape in our world, we have to constantly be evolving that toolbox. And if you're not really open to that, then you're probably going to leave a lot of people that will fall through your treatment cracks. And again, that is okay. And there will be providers that are continuously learning and growing that will be able to, pick those individuals up. But it really makes a big difference when we as providers who, like I said, want to be able to help everyone have that access to the clinical mindset and toolbox and other peers that we can learn from as well too. So in line with this gut series that we've been talking about, I really want to bring home kind of the pattern that I see a lot with individuals who come into my practice, and a lot of the same conversations that I also have with various providers who have either gone through different trainings before, different webinars before, and what are we kind of hearing and seeing in the trenches? What is working and what is definitely most not working in this field? So like I said, we've been talking about kind of some of these different diagnostic labels between leaky gut and candida and SIBO and IBS and all of these gut terms that leave people kind of overwhelmed and confused. But if you really zoom out, I'm a big picture person, so my brain is always zooming out. And in many, many clinical settings, both conventional medicine, honestly, and functional medicine, we keep returning to the same exact approach for all of these types of conditions. We think of, when it comes to the gut, we think it's this search and rescue mission of find the organism, kill the organism with antibiotics or herbal antimicrobials. We're going to put you on elimination diets and supplement stacks to really clean up the gut. And we cross our fingers and kind of hope that all of these symptoms resolve. And sometimes those things do help temporarily. But as a practitioner that has worked with hundreds and hundreds of pretty seemingly complex clients for any length of time. If you are also a provider that has really worked with anyone for a length of time, you've probably also seen your fair share of the other side of this story, where your tried and true protocols don't work. Or they work for 40% of people, and then 60% of people, they either get worse on your treatment or they are net same on your treatment. And these are the people that come to you and they've already done 3 different SIBO protocols. They've already rotated through every single antimicrobial on the market. They've been on restrictive diets for 3 to 5 years and somehow are actually more reactive to foods than when they started. And eventually we just have to start asking, like, why is my toolbox not working? Why are these gut protocols that were tried and true for me, why are my patients relapsing, or why are they not getting better? And today's episode of what I really want to dive into is all about this pattern. I see this pattern all the time, especially amongst, like I said, some well-intentioned practitioners who genuinely want to help their patients. And a lot of times we have to realize that sometimes the tools that have been made available to us are just as much as our biggest ally as they are our biggest enemy as well too, especially when you don't necessarily know how to use that tool. And the tool that I'm talking about here is going to be gut testing. Now, a lot of our gut testing is in the form of stool testing. There is some things that you can glean from blood work. There is some markers you can look at with urinary analysis. There's even some, markers you can look at from like a food sensitivity or an intestinal permeability panel. But I see so often, especially in the world of stool testing, because it's a little bit more trendy, it's a little bit more mainstream. And if you don't have the clinical skills as a practitioner to read between the lines, and if you're just taught to treat the lab and not treat the person in front of you, a living, breathing person that with multiple different moving parts and pieces, your protocols are going to fall short. I will tell you this through and through, especially in the ever-changing immune dysregulation culture that we have seen post-COVID. You cannot put individuals on kill products, especially from day 1, week 1. And if that is going to be your whole mission of run a gut test, find the bad guys, kill the bad guys, and then move on, you are doing no different than conventional medicine, who tests for H. pylori, puts someone on a triple antibiotic cocktail, and then moves on and wonders why they're back in their office 3 months later with the same issues or more issues. Or a provider who runs a SIBO breath test and puts someone on a course of 7 to 10 days of antibiotics, and then they're back in 3 months with the same issues or even worse. We're not doing anything different in functional medicine if that is how you are approaching your standard of care and how you are utilizing gut testing. So it is a hill that I will die on, is that gut labs are often being overinterpreted. They are being misused, in my opinion, and they're being asked to answer questions that they were never designed to answer in the first place, which means that the clinical focus is shifting towards what microbes do I need to kill, and less away from what the question we really need to be asking is. We need to be looking at what physiology is being asked to be restored in this scenario. So today we're going to dive a little bit deeper into some of these conversations where I really want to talk about the lab interpretation mistakes that I see most often with different practitioners and gut protocols until they kind of get enough experience with them or work with enough complex patients. I also want to talk about why stool testing sometimes rarely explains everything that's going on with someone on their own. And how if we just have that microbe focus, that we're not seeing the forest for the trees, so to speak, and we're lacking that holistic medicine approach that I teach to my providers within my holistic medicine mentorship program. So I do think, though, that, like I said, the rise in the availability of gut testing that we have in functional medicine is I love it. I think it's amazing. I've seen it be a game changer for individuals. And really where we saw the rise in this gut testing to begin with was really understanding that we needed a better central tool available than what conventional medicine had to offer. And so when we think about the gut testing, conventional gastroenterology, their screening tools are a lot more focused on identifying exclusively any abnormalities in structural physiology. So whether it's endoscopies, colonoscopies, essentially what we're looking for here is we're looking for ulcers, we're looking for tumors, disorders. We're looking for visible mucosal lining damage. We're looking for bleeding. We're looking for polyps. Like if something that could be seen on a scope or an imaging study, like it counted, okay? That is what conventional gastroenterology is really searching for. But more often than not, we know that it's the microscopic things. It's the things that you can't see on a scope that are truly running the show. So when someone comes in and has bloating and brain fog and fatigue, they have skin issues, they have food reactions, and like nothing obvious is showing up on a colonoscopy, and then they're just told like, oh, ship shape, everything's normal. You must just have IBS and get put on some prescription medications. That's where the functional stool testing has really come to shine, because functional stool testing has stepped into that very needed gap that conventional medicine didn't offer. And now suddenly we can really validate a lot of individuals' concerns by looking at the microscopic level that conventional gastroenterology doesn't have the capacity to see. Like it's just outside of their scope because it's not life-threatening. Their teaching and training is like, find the problem, diagnose the problem, prescribe the problem, fix the problem, and kick them out, right? It's like it's very acute medicine, and we need that. But individuals that are trying to use acute medicine for a chronic health condition are going to get disappointed 10 out of 10 times. So just like, don't do that, right? And we also know that what we can't see, even if we can't see it on a scope, does not mean that at a microscopic level, there is not some very real deficiencies and dysfunctions happening. So we get to actually look at, with functional stool testing, for the first time, it offered us the opportunity to see microbial diversity, good guys and bad guys. It gave us the opportunity to see digestion dynamics like stomach acid, bile flow. We get to see intestinal barrier function. We get to see inflammatory indicators. We get to see immune system activity. Like finally a window into the ecosystem that is running the show in here, which is so cool. But somewhere along the way, the narrative got shifted, and our practice of utilizing this tool, instead of utilizing it as a lab within the context of the greater individual, we started seeing it as like the main event. And that's where problems really started to show up. So the two biggest mistakes that I have seen with functional stool testing is, number one, when we have as a provider this mindset that we need to treat every microbe and as like a diagnosis, right? So it's when we have the mindset of like, I'm running a stool test to find a bad guy to kill. That is like mistake number one. Most common interpretation mistake by far. And I think it happens when we see certain providers that were maybe trained in conventional medicine, and then they find themselves trying to shift their practice into functional medicine. They still carry that quick fix mindset. And so they're still, even though they're maybe not using like antibiotics, they're still looking for something bad to kill, right? That's very common in a practitioner mindset that was trained in more of a Western medicine approach. But a stool test is really only identifying a handful of the potential organisms. And if you're just trying to find like a treatment target, you're like, I'm looking for Klebsiella, I'm looking for Citrobacter, I'm looking for H. pylori, I'm looking for Candida, I'm looking for Blastocystis, like, and suddenly our whole strategy is like eradicate everything that appears on the report, which is going to carry so much collateral damage, especially for your beneficial bacteria. And it also puts an incredible stress on the liver as well too. And guess what? Nobody is addressing then the most important question of why you should be running a stool test in the first place, which is, why did the terrain allow this organism to thrive in the first place? That's the question. The question is not like, how fast can I kill that guy? The question is why is the gut allowing that to even be there in the first place? Because those microbes are going to follow the physiology. They are not random, okay? They are not random why they're in there. The interpretation pattern cannot just lead to like this kill and remove loop, because what happens is, like I said, the client like test positive for microbial imbalance. So then what do we come in with? We come in with kill treatments. I need to use antimicrobials and antibiotics and biofilm disruptors and elimination diets and rotating supplement protocols. And when the protocol ends and the symptoms return, then we just start the antimicrobial phase all over again. I'm like, this is like purely the definition of insanity. And the client becomes more and more and increasingly sensitive to foods, becomes increasingly sensitive to certain supplements and also just stress, right? Because the underlying physiology that was driving that terrain was never even addressed in the first place. So that's mistake number one, is if you're running a stool test with the thought process that I'm going to find something to kill. That's probably going to lead you down a road that is not going to be the long-term solution for that patient, and frustration for everyone. Mistake number two that I tend to see is assuming that the stool test is explaining all of this individual systemic symptoms. And that is when we start to understand that the gut is really just a snapshot that is living inside adrenal physiology, nervous system physiology, thyroid physiology, sex hormone physiology. Like, you have a gut that is being constantly spoken to by all of these other systems. So let's just take, for example, maybe a client presents with chronic fatigue, hormone disruption, low testosterone, high estrogen dominance, brain fog, anxiety, skin issues, inflammation, and their stool test is positive for some mild dysbiosis. But again, the gut is not operating in isolation. That digestive physiology is being talked to and influenced by, like I said, their stress and their nervous system, definitely being signaled by the thyroid dynamics, blood sugar, nutrient deficiencies, circadian rhythm stability, inflammation pathways. So when those upstream systems are disrupted, then of course we're going to see microbiome shifts. That would just make sense. So that means that we're really just seeing sometimes a downstream snapshot of other things that are becoming a contributing factor as well too. So we can't just take the gut out of the body, tinker with it, and put it right back into the same body and act shocked when it reverts back. That is more of that systems and terrain level thinking. And again, that's what I teach inside my holistic medicine mentorship program, so that you can start to understand okay, yes, we can definitely take the gut out and tinker with it, but what am I doing with the other systems in the meantime? That's going to really bode better for this person's long-term approach. So I always have to, and I have to talk about this with patients as well too, because my mindset and my experience when patients work with me tends to be so different than what they've experienced before, in a good way, because obviously what they've experienced before hasn't worked well for them. And so when I'm talking to them, I'm listen, I know that every other provider has treated you as something to find that's bad or wrong and kill it and eradicate it. And that's not what's going to happen here. What's going to happen here is understanding that this is not a one thing. This is not, oh my gosh, I have EBV, I have Lyme, I have candida, I have SIBO, I have H. pylori. This is a terrain issue. This is a systems issue. So my brain is always looking at what systems are dysfunctional, what systems are deficient, because there's something that allowed this to grow and thrive in the first place. And I'm not going to just be another definition of insanity and just treat the same thing expecting a different result, right? So when you really think about the holistic medicine approach to more of a terrain level thinking, it's it's so different. Your brain really truly is blown, and you start to recognize how short-sighted our microbe focused thinking is, and how much more big picture and long-term effective it is when you can zoom out and look at the overall terrain and the overall systems. So as bright and educated practitioners that we are, you're going to quickly see how most gut protocols and most gut trainings out there are going to keep your mindset stuck in microbes focused thinking. And the immediate question is how do I eliminate them? But this approach just really doesn't work for everyone, especially in our more sensitive systems. And this is where we need a clinical shift, yesterday. We need to be thinking, and I teach inside my holistic medicine approach, I teach practitioners how to approach gut testing and gut interpretation very, very differently. Because I said, the microbes are not appearing in isolation. They expand in response to the terrain that they're living in. So the more clinically useful question that I help you really revert your brain to is, what physiological systems allowed this ecosystem to thrive in the first place? So when you look at gut labs through that lens, all of a sudden the entire treatment plan changes drastically. And instead of it being like a list of different bad guys to eliminate, it starts to become these physiological clues that you start to look at. You start to think of, is stomach acid sufficient to even regulate their microbial growth? Is bile flow sufficient to support fat motility or fat digestion and motility? Is their motility, their migrating motor complex, even kicking in to effectively clear bacteria through the small and large intestine? Is their nervous system in that parasympathetic supportive digestion mode? Are there nutrient deficiencies that are impacting tissue repair and immune signaling and enzyme production? Because these are the conditions that control the terrain of the gut ecosystem, okay? And this is why inside my holistic medicine mentorship program, I teach practitioners how to interpret gut testing within the context, alongside other objective markers like what does their blood chemistry look like? What about their hormone patterns, their metabolic signals, their detoxification capacity, as well as the patient's lived experience? Like their subjective data is just as powerful as well too. So unless we're willing to take on like a systems level thinking, you're probably always going to be stuck with this mindset that there's something that you need to find and there's something you need to kill and there's something you need to eradicate. And I just wish you Godspeed, good luck in working with individuals in the up and coming health culture. You're going to have a lot of individuals who find themselves getting worse based off of those protocols and based off of those systems level thinking. So I don't want you as a practitioner to start to question your toolbox. I want you to know where you can go and find education like my holistic medicine mentorship program to expand that clinical toolbox so you can help more people and not harm more people with that more like systems level thinking. So functional medicine, I won't lie, has done an incredible job at bringing the attention back to the gut. But then in good fashion, even functional medicine has also done our due diligence to kind of ruin that really good resource by applying the wrong mindset to a really valuable resource like gut testing and applying incomplete and uneducated interpretation protocols that are leaving people feeling really stuck and leaving a lot of practitioners kind of stuck in an imposter syndrome place too, where they feel like they don't have enough clinical skills to be able to work with the patients that they want to work with. So the gut is incredibly important, don't get me wrong, but it's just such a bigger part of the entire physiological network, and we need to understand how to restore that. So if you are a fellow practitioner out there and this episode and this conversation is resonating with you, especially if you've ever felt stuck in these rotating gut protocols without seeing resolution for your clients the way that you would want, this is exactly the type of clinical thinking that I go deeper with inside my 12-month holistic medicine mentorship container. So this was designed for practitioners who are ready to move beyond just like the test and treat model and start practicing like true systems physiology lens. And it's so much more rewarding. So inside this mentorship, yes, we're going to talk about, and I teach you how to interpret functional labs, gut testing, yes, but also blood chemistry, hormone patterns, metabolic signaling, detox pathways, and how to read that person's clinical presentation that's in front of you as well too. So that way you're not just chasing these like gut microbes one protocol at a time, and you're truly understanding how all of these systems interact together. So it's truly a transformative experience for not only you personally, but also professionally for your practice and for your patients. So if that's something you're interested in, you can head over to my website, thelowdownnutrition.com, all one word, no spaces, thelowdownnutrition.com, and check out my mentorship tab where you can find more information on how to apply there. And I hope to see and have more conversations with my fellow practitioners out there as we seek to make each other the best versions of ourselves and therefore the best care for our patients. We'll see you guys next week.